Hello, Study Nurse IQ family. Welcome back to the channel. I'm Jenny, and today we are tackling a critical, life-threatening complication in endocrinology, thyroid storm, also known as thyrotoxic crisis. This is a terrifying condition that demands quick, focused nursing intervention. This is a deep dive NCLEX review covering the causes, the crazy symptoms, the priority nursing interventions, and the must-know medications. Please stick with me to the end as we have NCLEX-style questions to test your knowledge on the material. Section 1. What is a thyroid storm? The basics. A thyroid storm is a life-threatening acceleration of hyperthyroidism. If hyperthyroidism is like your body running at 80 miles per hour, a thyroid storm is the engine totally redlining and about to explode. It is essentially an acute, severe surge of thyroid hormone in the body. A quick review of the thyroid gland. The thyroid is that butterfly-shaped gland located below your voice box. It produces T3 and T4 hormones. These hormones are absolutely vital because they are the master controllers of your body's metabolic rate. Key function of T3 and T4: controls metabolism. They help you burn calories and govern how quickly you replace old cells. Stimulates the heart. They increase your heart rate, blood pressure, and body temperature. Excites the nervous system. They stimulate the sympathetic nervous system, increasing alertness and reflexes. Needs iodine. The gland requires iodine to produce these hormones. In a normal person with hyperthyroidism, all these functions are sped up. In a thyroid storm, these functions are thrown into violent, accelerated overdrive. I like to call it a violent storm on the body. It's fast, accelerated, and quickly leads to exhaustion and death if not corrected. It is the complete opposite of myxedema coma, which is the sluggish complication of hypothyroidism. Section 2. What causes a thyroid storm? The triggers. A thyroid storm usually occurs in a patient who already has hyperthyroidism, often due to Graves' disease, but an additional stressor tips them over the edge. The causes or triggers you need to know are untreated or undiagnosed hyperthyroidism. The patient may not know they have it, or they may be non-compliant with their antithyroid medications. Acute illness or stress. Any severe stress on the body can trigger the crisis. This includes sepsis, diabetic ketoacidosis (DKA), a myocardial infarction (MI), or a pulmonary embolism. Surgery or trauma. A recent surgery, especially a thyroidectomy where the gland is manipulated, or trauma to the gland itself. Excessive iodine. Remember, the thyroid loves iodine. Exposure to large amounts of iodine can cause a massive hormone dump. This includes radioactive iodine treatment, iodine-containing contrast dyes for a CT scan. Medications. Certain medications like salicylates, aspirin, can actually increase the levels of circulating thyroid hormone, pushing the patient into a storm. Pregnancy. The hormonal changes of pregnancy can sometimes throw a susceptible patient into this crisis. Section 3. Signs and symptoms. The accelerated crisis. Your patient in a thyroid storm will exhibit severely exaggerated symptoms of hyperthyroidism. Their body is working at full exhausted speed. You must recognize these key, life-threatening changes. 1. High fever, hyperthermia. This is not just heat intolerance. It is a dangerously high fever, sometimes reaching 105 degrees Fahrenheit, 40.5 degrees Celsius or higher. 2. Severe cardiovascular collapse. Tachycardia and hypertension are severe. The heart is beating so hard and so fast that it's going to fatigue. Risk for arrhythmias, congestive heart failure, CHF, and myocardial infarction, MI. The heart muscles simply cannot tolerate the accelerated rate any longer. 3. Respiratory distress. They will have increased respirations as the body desperately tries to supply more oxygen to the overworked cells. If uncorrected, this progresses rapidly to respiratory failure. 4. Extreme central nervous system, CNS effects. The patient will be severely restless, irritable, and confused. This will quickly progress to delirium, psychosis, seizures, and finally coma. 5. Gastrointestinal GI effects. Their GI system is also accelerated, leading to severe diarrhea and abdominal pain. Section 4. Priority nursing interventions. The goal is to stop the body from burning itself out. Your nursing interventions are focused on stabilizing the patient, reducing the circulating hormone and decreasing the hyperthermia. Monitor vital signs closely. Continuously track their heart rate, blood pressure, respirations, and temperature. Monitor the EKG for arrhythmias. Be ready for respiratory failure. They may need mechanical ventilation. Cool the patient. Implement immediate cooling measures to combat the hyperthermia. This includes cooling blankets, cool fluids, and a cool, quiet environment. Quiet environment. The sympathetic nervous system is highly stimulated. A calm, quiet environment with minimal visitors and stimulation is crucial, and a sedative may be ordered. Iodine restriction. Absolutely no foods or medications containing iodine, as this will fuel the crisis. High iodine foods include seafood, kelp, seaweed, dairy products, and eggs. Section 5. The essential medications. The medications are given to achieve 4 main goals. Goal 1. Block thyroid hormone production. We give anti-thyroid medications to block the synthesis production of T3 and T4. Tapazole, also called methimazole. This is commonly used and has fewer side effects. Nurses, remember, this drug cannot be used in the first trimester of pregnancy. PTU, also called propylthiouracil. This is the drug of choice for patients in the first trimester of pregnancy. However, be aware that PTU carries a high risk for liver failure, so we must monitor liver enzymes closely. Side effects to watch. Both drugs can cause signs of hypothyroidism if the dose is too high, and severe blood dyscrasias like agranulocytosis, very low white blood cell count, and thrombocytopenia, very low platelet count. Goal 2. Block thyroid hormone release secretion. Iodide solutions, Lugol's solution. This acts quickly to block the release or secretion of the thyroid hormone already made. Note, we usually give the antithyroid drug first, then the iodide solution about 1 hour later. Side effect. Patients may report a metallic taste in their mouth. Goal 3. Treat the symptoms and block effects. Beta blockers, like propranolol. These are vital. They help the patient by decreasing the accelerated heart rate and blood pressure. They also block the peripheral conversion of T4 to T3, which is a powerful action. Nursing alert. Do not give beta blockers to patients with a history of asthma or bronchospasms. In diabetic patients, watch for masking signs of hypoglycemia like tachycardia and sweating. Fever reduction, acetaminophen, Tylenol, use only acetaminophen. Never give salicylates, aspirin. Remember, salicylates increase thyroid hormone levels, so they are strictly contraindicated. Goal 4. Suppress the immune system. Glucocorticoids like dexamethasone. These steroid medications are often ordered to suppress the immune response that may be contributing to the crisis and to further decrease the peripheral conversion of T4 to T3. Now let's test your knowledge with some NCLEX-style quick quiz. Question 1. The nurse is assessing a patient admitted in a thyroid storm. Which set of findings represents the most critical, immediate life-threatening concerns? A. Low-grade fever, bradycardia, and fatigue. B. High fever, severe tachycardia, and altered mental status. C. Cold intolerance, dry skin, and constipation. D. Hypothermia, bradycardia, and lethargy. Answer. High fever, severe tachycardia, and altered mental status, delirium or seizure. Rationale. These 3 signs, hyperthermia, severe cardiovascular overload, and CNS excitation, are the hallmarks of a thyroid storm and indicate imminent cardiac and neurological collapse. Question 2. A patient with a history of hyperthyroidism has developed a severe infection and is ordered tapazole, methimazole. The nurse should prioritize monitoring the patient for which dangerous side effect of this drug. A. Weight gain and constipation. B. Increased salivation and drowsiness. C. Signs of infection such as fever or sore throat. D. Hyperactivity and tremors. Answer. Signs of infection, fever, sore throat, due to agranulocytosis. Rationale. Antithyroid drugs like tapazole and PTU can cause severe blood dyscrasias like agranulocytosis, a dramatic drop in white blood cells, leaving the patient highly vulnerable to infection. Question 3. Which medication is contraindicated for fever reduction in a patient experiencing a thyroid storm? A. Ibuprofen. B. Acetaminophen, Tylenol. C. Aspirin, salicylate. D. Naproxen. Answer. Aspirin, a salicylate. Rationale. Salicylates increase the levels of free thyroid hormone in the blood, which would exacerbate the hypermetabolic state of a thyroid storm. And that's the end, guys. You are absolutely amazing for studying with me today. If this video was of value or added value to you, please head to our YouTube channel, Study Nurse IQ, and click subscribe. Thank you so much for watching and keep crushing those exams. I will see you in the next video.